Listen to me, and listen to me closely. We are talking about your health, your money, and your ultimate freedom in your golden years. You have worked your entire life to reach this point. You've saved, you've sacrificed, and now you're standing at the doorstep of retirement. And then, you see the commercials. You know the ones. They've got the smiling faces, the legendary quarterbacks, and they are promising you everything for nothing. $0 premiums. Free dental. Free vision. We'll even give you a grocery card. And you think to yourself, Susie, why wouldn't I do this? It sounds like a gift. Stop right there. I need you to stand in your truth for 1 second. Because there is no such thing as a free lunch in the financial world, and there is certainly no such thing as a free lunch in the healthcare world. Today, we are going to pull back the curtain on the dirty secret of Medicare Advantage that the insurance companies, and those slick commercials, do not want you to understand until it is too late. Here is the problem: you are being sold a perk when what you actually need is protection. Medicare Advantage, or Part C, is not the same as original Medicare. When you sign up for an Advantage plan, you are effectively leaving the government-run system and handing your healthcare over to a private insurance company. They become the gatekeeper. Now, why does that matter? It matters because of the first big fear every retiree has, the fear of being denied care. Under original Medicare, if a doctor who accepts Medicare says you need a procedure, you get it. Period. But under Medicare Advantage, the dirty secret is prior authorization. You want that MRI? You want that specialized surgery? You want that specific brand name drug? The insurance company has to say yes first. And guess what? Their goal is to manage costs. In 2026, we are seeing more and more stories of people just like you, who thought they were covered, only to find out their Advantage plan denied a claim that original Medicare would have approved in a heartbeat. Are you kidding me? You've spent 40 years paying into the system, and now, when you're at your most vulnerable, you want to ask a for-profit corporation for permission to get healthy? That is not how you live a life of power. The second part of this secret is the network trap. They tell you, oh, we have a vast network of doctors. But networks change. Doctors leave. Hospitals renegotiate. You might have a doctor today that you've seen for 20 years, but if that doctor drops out of your plan's network next year, you are stuck. You either pay full price out of pocket, which could bankrupt you, or you find a new doctor. And if you're a snowbird? If you live in Florida in the winter and Michigan in the summer? Good luck. Most Advantage plans are HMOs or PPOs that are geographically locked. If you get sick outside of your service area, you could be looking at out-of-network costs that will make your head spin. With original Medicare, you can go to any doctor, any specialist, any hospital in the United States that accepts Medicare. That is freedom. Medicare Advantage is a cage. Now, I know what you're asking. Susie, the commercials say I'll save so much money. My premium is $0. Let's talk about the math, because the numbers never lie. Yes, your monthly premium might be $0. But what is your maximum out-of-pocket? In 2026, the limit for Medicare Advantage plans can be as high as $9,250. Think about that. If you stay healthy, the plan is cheap. But the moment you get a serious diagnosis, cancer, heart disease, a major fall, you could be on the hook for nearly $10,000 in copays and coinsurance before the plan covers 100%. If you had original Medicare with a Medigap, Medicare supplement, policy, your out-of-pocket costs could be near $0 for covered services. You are trading a guaranteed monthly cost you can budget for, a Medigap premium, for a massive, unknown financial risk. You are gambling with your retirement savings. Is a free gym membership or a $50 grocery card really worth risking $9,000 of your hard-earned money? No, it is not. So, what is the actionable takeaway here? What do you need to do right now? First, you must look past the perks. Ignore the dental, the vision, and the hearing extras for a moment. Those are the shiny objects meant to distract you. Look at the medical coverage. Ask yourself, if I get the worst news possible from a doctor tomorrow, do I want to be in a plan that requires prior authorization and limits me to a local network? Second, do the sick person math. Don't buy a health plan for the person you are today, the one who is healthy and walking the dog. Buy the plan for the person you might be in 5 years. Calculate the total cost of a Medicare Advantage plan if you hit that $9,250 out-of-pocket limit versus the annual cost of a Medigap Plan G. Third, understand the one-way door. In many states, if you choose Medicare Advantage now and decide you hate it later, you might not be able to get back into a Medigap plan without a medical exam. If you've developed a health condition in the meantime, the supplement companies can charge you more or deny you entirely. You are effectively locked into the Advantage system once you're sick. I want you to be safe. I want you to be secure. And most importantly, I want you to be in control. Do not let a celebrity in a commercial tell you how to manage your health. You are the master of your own destiny. Investigate the network, understand the prior authorization rules, and for heaven's sake, look at the out-of-pocket maximums. Wealth is not just about the money in your bank account, it's about the peace of mind knowing that when you need care, you will get it, without asking for permission.